Hello everyone. Today we are talking about preterm labor. What is term labor? 40 weeks is the normal human pregnancy, but when the baby is delivered before 37 weeks, it is called preterm. Sometimes may be delivered before 24 weeks, it is called severe preterm, extremely preterm. These babies have got problem. The survival rate is very poor. Why are we so bothered about the preterm labor? The preterm baby has got lot of morbidity and mortality. This is main problem for the high neonatal mortality rate in worldwide, and the highest rate is in India, which is one of the developing countries. These preterm babies suffer from immaturity. The organs are not well developed, and a very preterm baby will have a problem with the eyes, with the neural tube, nervous development, and ultimately they end up in a very bad shape. So this morbidity and mortality has to be controlled. This can be done by an active management of pregnancy. So you should be very careful when taking history so that you know what are the causes, risk factors for the preterm labor. A patient who had previous preterm pregnancy, or the patient is having a previous DNCs or developed by IVF, or elderly patient or very obese patient or diabetic is more prone for preterm pregnancy, and these patients should be counseled. They should look for the morbidity and mortality by looking at the vaginal infections, ruling out the urinary tract infection, treating the preeclampsia, diabetes, so the baby grows healthy. Whenever you suspect a patient complaining of backache, of urinary tract infection, treat it. Vaginitis should be treated, and at the same time, you do a scan. A serial scan will show whether the cervix is shortened. Normal is around 3 centimeters. If it is less than 1.9, or when there is funneling of the membranes into the cervix, when you then suspect case of cervical incompetence. So these patients should be supported by giving progestational hormones. At the same time, if needed, you may also have to give cerclage and cervical encerclage, by which there is some amount of help to prevent the preterm labor. And at the same time, these patients can be given tocolytics to quieten the uterus. And one thing you should be very careful is, these patients, when you suspect preterm labor, they should be shifted to higher center so that they deliver in a place where the NICU facilities are there, and the baby can be saved better. So, looking for signs and symptoms of preterm labor, looking for an ultrasound findings for giving cerclage, and giving corticosteroids at around 32 weeks, and giving progestational hormones, especially micronized progesterone, when you suspect almost up to 32 weeks, will help in preventing preterm labor, will reduce the burden both on society and the government, and we can save many babies. Thank you.